So with COVID-19 resources, what we've been doing since January is it started off with nightly calls. So every night we had just an open forum Zoom call with the public to answer questions from anyone who felt like dropping in. Then we started to ramp that up, scale that up towards more focused calls for targeted groups. So we were doing unions and workplaces and religious communities. Any group of people basically who wanted to have a private call, we were available for them as well. Some common questions that we were getting, especially at the beginning, were the vaccines made too fast? And what does that mean for the quality of the vaccine? Can we still trust them if they're made rapidly? And I guess to answer that really quickly, yes, they were made rapidly in a faster timeline than we're used to, but there were no safety steps that were skipped. So that's a common question that comes up. Often it's some of the misinformation that gets spread online that we help to demystify a little bit. Right now, you kind of have a choice. So essentially, if you have a medical reason to not get one of the particular vaccines, for example, an allergy to one of the components in the vaccine, then certainly you will have that option. You'll have the option to pick one that you don't have an allergic reaction to. You can also choose in the sense that you can choose the location where you want to get the vaccine. So some vaccines might be offered only in pharmacies or doctors' offices. The general advice, though, is to take the first vaccine that's offered to you, that's approved for you to use. The faster you can get protection, the better for you, the better for your community, the better for your family. Some 1 in 100 cases of COVID results in blood clots forming. So you also want to think about what is your risk factor, what is your personal risk of getting COVID, so that you don't get blood clots and you don't get all the other complications that come along with COVID. And if you decide that you don't want one particular vaccine, you want to wait for a different vaccine that can be offered, then you have to think about what is your risk of getting COVID in that waiting time. How long would you have to wait? If it's a few days, it's not a big deal. If it's a month, 2 months, that's quite a bit longer. And your risk of contracting COVID when there's a lot, or if there's a lot of COVID in your community, will be much higher. It's also important to keep in mind that there are symptoms, detectable symptoms for blood clots. Right now, Health Canada advises to look out for symptoms including shortness of breath, chest pain, leg swelling or pain in your legs, persistent abdominal pain, a sudden or severe or worsening headache, a very, very severe headache, blurred vision, confusion, any unusual skin bruising or bleeding. And this will, if this occurs, it would be between 4 and 20, let's say, a month after your vaccine, 4 and 20 days after the vaccine. So it's not a lifelong risk, it's just in a short period after your vaccine. If you experience these symptoms, it's important to get medical care right away and let them know that you had which vaccine you received, just in case there's a relation. And of course, it's also important to know that there are treatments available for these blood clots. So people who have experienced these conditions after vaccination have been successfully treated and are resuming their lives as normal. So these are all the things you want to factor in if you happen to be offered the AstraZeneca vaccine, if that's the first one offered to you. Of course, blood clots occur for any number of reasons. Sometimes we don't know why they occur at all, and that includes CBST. Sometimes it just happens. And so these symptoms are good to keep in mind for any day-to-day activity in your life. It's always good to know what's going on. Symptoms are pretty severe, so it's something that would definitely warrant a medical visit. But yeah, I think in general, your risk of getting a blood clot after the AstraZeneca vaccine is very, very low. It seems to be in the range of about 1 in 100,000. So your individual risk is very low. But we know that when we give this vaccine to millions and millions of people, we're going to see it. There are going to be a certain number of people who are going to, and that's happened. Canada has already had a few cases as well. Most have been treated, and that's I think that's important when you're factoring in your risk-benefit analysis. So overall, you want the benefits to outweigh the risks, and you want the benefits to outweigh the risks by a lot. And that's why the current recommendation in Canada is to only offer the AstraZeneca vaccine for anyone over the age of 30. I think if there's a lot of COVID in your community, which right now in Canada, a lot of places are facing really high community transmission of COVID, then your risk of catching COVID, your risk of getting severe outcomes, especially with the variants that were circulating that seem to have higher risk of hospitalization, those risks outweigh the risk of getting a vaccine. But that's something that I think is really important for people to consider, to keep in mind, to really think about what their exposure risk is with respect to getting the virus. That's what we have to weigh this against our risk of getting the virus. I have, yes. I have my first dose. I'm waiting 4 months, like the rest of Canada, for my second dose. And I took it right away, no hesitation for me. I had done a lot of, I looked into it, of course, and I wanted to make sure that I made the best choice. And I feel very confident that it was a good, safe choice and the right choice to make for myself, my own health. I am not interested in taking my chances with COVID. I do not want this virus. And also for my family, I know that I will be reduce my risk of being a vector to infect the people around me. This is based on real world evidence that we're seeing from the UK in particular. I think they did a 3-month delay for their second dose, and it's had phenomenal results for them. The bigger picture for it is to protect as many people as we can on a smaller time. So we know that we're kind of racing against time with COVID, especially as our third wave was picking up. We're slowly getting to on the other side of that, which is nice. So race against time, against these variants, against COVID in general, and we'd have limited doses. So we didn't have enough to cover a whole bunch of people. But we see that just one dose alone offers substantial protection against disease, against hospitalization, which is really important. We want to be able to protect people. So we know that we're not giving one dose and it's not doing nothing. So we're able to offer that protection, not the full protection that we're seeing with 2 doses, but a lot of protection to more people. Yeah, well, we know that people who are vaccinated, even fully vaccinated, there's going to be some number of people who will still get the virus. We saw this in the clinical trials, so this isn't unexpected. But it's going to be a far lower number, far lower percentage of people compared to unvaccinated people. That's where that effectiveness comes in. So the risk has been reduced, but the risk isn't zero. I can't speak for all of Canada, but I can speak for Ontario, where I live, and where I'm seeing it more firsthand. There have been a lot of challenges, I think, with reaching some communities, and that comes down to just the way the vaccine rollout has taken place. It's been a bit decentralized. So there is a provincial website to go and sign up and to identify where you can get the vaccine. But then you also have to go to your public health unit individually. And if you've never really interacted with a public health unit before, like me, I didn't really know what they were before this pandemic. It's really confusing, and it's hard to figure this out. Beyond your public health unit, you can also contact the hospitals themselves or the pharmacies themselves. And so when I had to book for my parents, I had to call many pharmacies, and a lot of them didn't have any vaccines, and I had to put them on the wait list in many different places. And I was like, why is it so complicated? This is very difficult. So I had the time to do that, but someone without that kind of time, someone without those computer literacy skills, someone without without even the motivation to want to do it that much, like it seems not worth it for a lot of people, I'm sure. So there's a lot of barriers in actually trying to book the vaccine. There are also barriers in where the vaccines are and where they're located. We know right now in Ontario, a lot of vaccines are being offered in community pharmacies, but we've seen that some communities with higher caseloads have fewer pharmacies offering vaccines. So just getting the vaccines to where they need to be has been a huge challenge. And it's the same communities who've had the highest impact from COVID who are being left behind in the vaccine rollout. And that's the lack of equity in our vaccine rollout approach. I guess I wish we had a centralized provincial booking system. But I think that's what the Vax Hunters have kind of accomplished. That they've become more of a centralized source for people that was impossible to navigate in a lot of other settings. The vaccines are safe. I want people to feel comfortable asking questions about the vaccines and knowing where to get information. Best people to talk to are someone who knows your health history, so your own family doctor, your local pharmacist, someone familiar with with you, your health, who can really answer more specific questions for you. There are a lot of resources online, a lot of societies, for example, the Society of Obstetricians and Gynecologists of Canada. They're a great resource for anyone who's pregnant or breastfeeding and has questions about vaccines or about COVID-19 in general. Going directly to the NACI website or Health Canada website is also a great place to get information. These are really hard to synthesize and hard to put together sometimes. And I know that it creates a lot of challenges, and I think that social media becomes a very appealing place to get information too. I've definitely gotten a lot of information there, but it's really important to be critical about our sources. Do they provide references? Do we know who runs the account, right? Is there transparency on who these people are? Things like that. The biggest takeaway for me is there's a lot of misinformation, and a lot of it is really intentional. It's put out there specifically to confuse us and to give us wrong information. So it's really important that we're really careful about what the kind of information that we consume. I think it's important to always approach with empathy and just listen, listen with compassion and be open-minded to hear what they have to say. Try to really get to the root of their concerns. Some people might ask, are the vaccines safe? But what they're really asking is it safe for me? And try to understand why they would think that it's not safe for them. What are they really? What is the heart of their concern? People don't change their mind on the spot. It usually takes them a bit of time. So I think just being patient as well in those conversations and choosing the right time and place for those kinds of conversations as well. Beyond that, while they make that decision, then it's good to think about the other public health measures that we have to keep us safe from COVID-19. So distancing, hand washing, wearing masks. We know that these things work. We know that these are effective ways to lower our risk. And I try to emphasize too, if people have concerns about trusting the big pharma, or trusting the pharmaceutical companies or something. I don't have to trust the pharmaceutical company to trust the vaccine. I think it's important to remember that we have regulatory bodies who serve as a buffer between us and the company. So we don't have to take the company's word for it. We just have to trust, listen to the guidance from our own regulatory bodies. Our scientists and professionals who work on this day and night, working really overtime to make sure that these things are safe. And beyond that, in the real world, when the vaccines are out, the safety continues to be monitored. So the standards don't get lowered. That's how we know about the blood clots, for example. They're always watching, and we know the system's working because they were able to find these things as well. I feel confidence in that. And I also feel confidence in the science, but I know I have a background in science, so it's maybe easier for me to have that confidence. I'm happy to help spread that joy.